High value action number two. And this one has a little bit of a bonus here. Annual wellness visits, and I'm going to slot in in-home assessments with that, just depending on kind of the population that we're talking about. This is really akin to the PCP visit, but it can be a different way to nudge a similar action of, hey, we want to get in touch with you at a human level because there are a lot of different resources that we can connect to you if we just have that 30 minutes with you. You can see some of the stats here on the screen, but the biggest piece of this, I think, is the desire for this connection to be made, but not for what is perceived as complexity or maybe an inability to access that care. So 61% of patients wanting more engagement, and by extension, members wanting that engagement, that is a huge opportunity to say, well, we're the plan that makes that really easy. And doing so in all of the correspondence, again, focusing on ease and access, those are places that we know there is want. And we also know from a payment side, what we looked at up front, that convenience and that positive experience is a place that we're going to see kind of focused on in the CAP surveys. And we're also seeing some of the sort of corollaries in the star rating. So getting that needed care, again, being a principal one. A little bit of a nod over on kind of reading the tea leaves, especially on the Medicaid side or the dual side, is thinking about social determinants of health, or SDOH, and knowing that the risk adjustment around that is kind of a fluid conversation. But the idea that really looking at those in-home assessments, especially as health plans can start to understand someone's broader sort of social determinants and their broader environment. You know, for example, getting into that assisted living facility where we might have somebody living and understanding and being able to account for the risks that live there with that person. Those are places that we can start to really code the right way and understand the full gamut of risks associated with our member. So those things happen when we have the in-person discussion, and all the better when we have the in-person discussion in the place that person resides, if possible. Man, access and simplicity, we're beating the right drum here, but a couple others that I would look at on this are, I mean, certainly empathy, that probably plays a part in any of these measures, but in particular with those people that in particular have not made an annual wellness visit or have never had that interaction with us, just sort of understanding where they're at, but then also leading them with authority to say, by doing this, you increase your likelihood of, and whatever the data is that we want to include that we feel would be compelling, but that ability to establish trust through authority can really help tip the scales and get someone to take that action. So it's one that's worth including as a line or two, or at least testing it out as a line or two within your comms.